Hi, my name's Jo.
My name's Andrew.
We're research doctors at the University of Oxford, and we're here to tell you why, in some very special studies, we deliberately infect volunteers with malaria.
Malaria is an infectious disease transmitted by mosquitoes. It is most common in countries in Africa and unfortunately continues to cause hundreds of thousands of deaths every year, particularly in children under the age of 5.
So here in Oxford, we're developing vaccines to try and prevent this disease, and we are making progress, but even better vaccines are urgently needed.
One way that we can test to see if our vaccines work is by performing something called a malaria challenge study. This is where we deliberately infect volunteers with malaria, either by injection or mosquito bite, and monitor them very closely, tracking the infection levels on daily blood tests.
So if our vaccine's effective, then we'll see slower malaria parasite growth in our vaccinated volunteers compared to those unvaccinated individuals. And this helps give us an early idea of whether our vaccine will be effective in the real world.
Participants often develop early malaria symptoms such as headache and fever, but we monitor them very closely and start treatment with malaria tablets at an early stage of infection. Malaria is a potentially serious disease, but if a participant attends the follow-up visits, the risks of participating are very low. Volunteers are an essential part of this process, and we couldn't do it without them. So far, over 500 people have participated in malaria challenge studies here in Oxford. So don't just take our word for it. Here are a couple of volunteers to tell us a bit about their experience of participation.
My name is Kate. I'm a content project manager.
So my name's James. I'm 28 years old. 2 years ago, I joined one of the malaria challenge trials here in Oxford.
Yes, the malaria challenge study. It involved being injected with malaria parasite-infused blood. After having been injected with blood, it involved coming for daily visits over a period of 2 weeks. And they were just to take a blood sample and blood pressure, etc., vital signs. So it was probably like 5-10 minute visits, not too taxing.
So the actual challenge itself, pretty quick, no big dramas, nice and easy. So I was thinking, malaria, horrible tropical disease, going to be stuck in bed for weeks. But no, the actual symptoms themselves weren't anywhere near as bad as I was expecting.
The study team wanted to make sure that I am safe, and the minute that the parasite count is high, the treatment would kick in and get started. So I knew that even if my symptoms were more severe, I was in good care.
So the whole team was super supportive. I was really well looked after throughout the whole thing, so I didn't have any concerns. So the various strains of malaria affect a few 100 million people every single year. In the global south, it kills tens of thousands of people every single year. So if it's possible that the work here at Oxford can help create a vaccine to prevent that from happening, that's then going to save thousands and thousands of people from suffering that doesn't have to happen.
If I, as a healthy person, could be part of a potential vaccine that could help many, many lives worldwide, why not do that?
So there you have it. That's why malaria challenge studies play a vital role in malaria research.
And with this work, we aim to develop vaccines that will continue the fight to eradicate malaria.